Hi everyone, this is Group 8, and today we'll be presenting our mock funding proposal on implementing a smart sensor alert system, a simulation-based intervention to improve perineal care and prevent incontinence-associated dermatitis, IAD. What is the problem and why does it need to be addressed? When incontinent patients are not changed promptly, their skin is exposed to prolonged moisture from urine or feces. That moisture breaks down the perineal skin, leading to redness, itching, and painful rashes, which are all symptoms of IAD, as shown in Figure 1. This could lead to pressure ulcers and urinary tract infections. Without timely perineal care, these complications delay healing, increase discomfort and depression, and even raise early mortality rates as well as healthcare costs. Prevalence and impact. Research tells us that nearly half of hospitalized incontinent patients develop IAD, with 19% of incontinent long-term care residents in Ontario going on to develop pressure ulcers, which has been associated with an elevated 30-day mortality. Pressure injuries can extend hospital stays by 2 days. This is shown in Figure 2, where the length of hospital stays for incontinent patients was 6.4 days versus 4.4 days for continent patients. As a result, the mean total index hospital costs increased from $13,700 for continent patients to over $17,000 for incontinent patients, and even by an additional 30% if IAD is present. Now, how widespread is this problem? As shown in Figure 4, in German long-term care homes, 21% of incontinent patients showed signs of IAD, whereas in Australia, 10% of older adults admitted to one hospital were diagnosed with IAD. A Belgian study found 22.3% of incontinent residents had IAD at baseline, and surveys across acute and long-term care settings in the US and Canada report roughly an 18% prevalence among incontinent patients. The good news is that we know how to prevent IAD. Breathable, highly absorbent briefs help draw moisture away, helping maintain dryness and prevent skin breakdown. Infusing briefs with zinc oxide barrier cream cuts both the incidence and severity of IAD. And the 3-step cleanse, protect, restore protocol, which includes gentle pH balance cleansing, barrier application, and moisture locking dressings, can reduce new lesions by roughly 40%, also reducing hospital-acquired pressure ulcers and shortening stays. In ICU settings, daily 2% chlorhexidine baths have been shown to reduce overall infection rates from 3.43% to just 0.58%. What have other settings or people done to address this issue? Well, Tekken and colleagues developed an inkjet printed humidity sensor that adheres to adult briefs and detects as little as zero point 0.1 mils of moisture within about 42 seconds. Importantly, it maintained accuracy even as patients moved, offering a promising tool for real-time monitoring and timely intervention.
To address this problem, we believe it's time for a smarter, more proactive solution. That's why we're proposing the implementation of a smart sensor alert system, which is a low-cost, high-impact innovation inspired by the work of Massachusetts Institute of Technology. This system integrates real-time urine and pH detection with wireless alerts that notify staff instantly through the call-bell system or mobile devices. Once triggered, care teams follow an evidence-based hygiene protocol, which includes cleansing with 2% chlorhexidine, applying a rinse-free cleanser, and protecting with zinc oxide barrier cream. Chang et al. 2025 found that when this protocol is applied promptly, bacterial growth and UTI risk can drop by more than 80%. But detection and response alone are not enough. That's why we've incorporated a data analytics dashboard that logs every alert and response time, monitors IAD and UTI trends, and flags delays or inconsistencies in care. As shown by Buchanan et al. 2022, these dashboards promote accountability, guide infection control strategies, and support continuous quality improvement across units. To ensure successful adoption, we've also created a simulation-based training program where staff can practice using the sensor, respond to alerts, apply the 3-step hygiene protocol, and engage with the dashboard in realistic scenarios. This hands-on learning highlights the real-world consequences of care delays and empowers staff to intervene early. Ultimately, our smart sensor alert system isn't just about technology. It's about transforming the way we think about incontinence care. It reduces complications, supports timely interventions, lowers costs, and restores a sense of dignity to those most vulnerable. We're asking for your support to pilot this system, implement staff training, and evaluate its impact. Together, we can drive meaningful change in patient care, one alert at a time.
For our resources, we'll use the clinical simulation lab that every hospital already maintains, complete with mannequins and standard infection control supplies. For human resources, our fourth-year nursing students will lead the project, supported by lab facilitators, educators, and a simulated patient actor. The hospital will provide gloves, briefs, 2% chlorhexidine, rinse-free cleanser, barrier cream, and wipes, everything you'd normally need for perineal care. Finally, we'll deploy our sensors that will notify the mobile alert system within seconds of fluid detection. For activities, we'll kick off with an educational workshop where we'll outline our learning goals, explain why real-time moisture detection matters, and review the 3-step perineal hygiene protocol. Next, participants will enter the smart sensor simulation. In small teams, they'll observe the underpad alert in action, respond to the mobile notification, and perform the cleansing and barrier cream steps just as they would at the bedside. After each scenario, we'll pause for a debrief discussing participants' response times, any obstacles encountered, and how the team coordinated care efficiently. Finally, we'll wrap up with an evaluation and Q&A session where we'll confirm everyone can activate the sensor, interpret alerts, and execute the hygiene protocol correctly. For the timeline, we'll begin in week 1 with a literature review and learning plan. Week 2 is gathering equipment and lab simulation setup. In week 3, we recruit facilitators. Week 4 is for pre-testing, and weeks 5 and 6 include running full simulation sessions and evaluating the outcomes. Now let's look at the budget. We'll need 50 smart sensor underpads at 2 cents each, which comes to just $1 for our entire simulation. We'll also engage one nurse educator for 6 one-hour sessions at $35 per hour, totaling $210. That brings a total direct cost to $211. A minimal investment, especially considering that simulation lab access and all cleansing supplies are provided by the hospital unit at no charge. And because these pads are so affordable, the hospital can easily order additional smart sensors to match the number of incontinent patients on any given unit. To evaluate its success, we'd first look at improved health outcomes. We expect to see a reduction in incidence rates of IAD, as well as the number and severity of pressure injuries and UTIs after implementing the sensor system. Second, we're aiming for a timely response, where we would record the time taken from a moisture pH sensor alert to when perineal care is performed, aiming for 90% of interventions completed within 10 minutes. Third, we want to see improved skin integrity. Using the Braden scale to assess skin integrity and monitoring weekly IAD incidents, we aim for at least a 40% reduction in mean severity by week 8. Finally, we'd expect higher user acceptance. If 90% of healthcare providers rate the system as helpful and easy to use, showing technology acceptance model scores averaging above 4.2 out of 5, that would suggest strong user friendliness and long-term sustainability. To evaluate the change project, we'll start with a pre- and post-implementation comparison. That means looking at health records and infection data from the 8 weeks before and after introducing the system to see how outcomes like IADs, UTIs, and pressure injuries change. This method aligns with Lee and Kim's 2025 study as seen in Figure 3, which found that traditional topical creams resulted in poorer skin integrity with a perineal score of 8 and an IAD score of 18, while smart diaper sensors reduced scores significantly, showing a perineal score of 4 and IAD score of 1. For our statistical analysis, the infection control and quality improvement teams will review weekly charts to track complication rates and response times. To ensure adherence to protocols, we'll conduct weekly chart audits focused on the 3-step perineal care protocol. These reviews will help us document any gaps or barriers in practice. Finally, for qualitative feedback, we'll carry out semi-structured interviews and focus groups with both staff and patients. Using the technology acceptance model as our framework, we'll explore usability issues, integration challenges, and perceived benefits of the intervention. Are there published measures or precedents for evaluation? The Ghent Global Incontinence Associated Dermatitis Tool, GLOBIAD, has demonstrated high diagnostic accuracy and inter-rater reliability in grading IAD severity and is broadly used in both research and clinical practice. Systematic reviews of healthcare applications of the Technology Acceptance Model, TAM, consistently show that mean TAM scores of over 4.0 indicate strong end-user adoption of new clinical technologies.
Incontinence care is often overlooked, but the consequences are serious. Complications like incontinence associated dermatitis, pressure injuries, and UTIs are preventable, yet they continue to harm patients, extend hospital stays, and increase healthcare costs. Our smart sensor alert system changes that. By detecting moisture and pH in real time, it ensures timely, standardized perineal care. No more relying on chance or workload availability. This innovation protects skin integrity, prevents infection, and upholds patient dignity. With data tracking built in, our system also supports ongoing quality improvement and system wide efficiency. This isn't just about technology, it's about safer care, better outcomes, and smarter nursing. That's the future we're building, and we invite you to help us make it happen.